session is on imaging and diagnostics in orthopedic oncology. It's a very interesting topic. It has been close to my heart since my MBBS days. As initially I wanted to be an orthopedician, but later on decided to join general surgery because that is where I got inclined towards. But still, a lot of these topics still stuck with me, and during my surgical oncology training, I was very much interested in orthopedic tumors. So today we'll be discussing the diagnostic approach using imaging and the modern diagnostics that are available for orthopedic tumors and from suspicion to staging, and then we'll move towards treatment planning. And like every lecture, this lecture will have the objectives of understanding the advanced imaging modalities used in bone and soft tissue tumors. So after this class, you'll know when to use an X-ray, when to use an MRI, when to use a CT scan, when to use a PET scan, what are the different types of bone scans available, and how to utilize all of them, how to read a basic MRI, and how to differentiate between the T1, T2 weighted images. So this is what I want you to learn from today's class. You will learn the principles of biopsy in musculoskeletal oncology and appreciate the radiological staging and tumor localization, especially for soft tissue tumors. Understand the role of interventional radiology in management of these cancers and integrate molecular imaging into tumor management. And like every oncology class, I will again emphasize on molecular imaging and the molecular genetics because it has taken over the oncological care to a whole new level. And by the end of this session, you will be able to select the appropriate imaging modality for suspected bone and soft tissue tumors. You will be able to interpret the key radiological features which are suggestive of malignancy. You will also be able to understand how to plan the biopsy and what are the different techniques that are used in the biopsy of these tumors, and apply these staging systems, whether it's Enneking system, TNM system, where it is used when, and how to stage the tumor based on imaging, and then again integrate imaging findings into multidisciplinary decision making. So starting with the introduction, the imaging remains central to diagnosis whether it's a benign or a malignant case. For the T staging, that is the local staging, for bone, soft tissue, and neurovascular involvement. Metastatic workup, that is the N and the M staging. Biopsy planning, for which plane to go through. Guided biopsies, and then surgical planning and limb salvage. Finally, an incorrect imaging or biopsy can really compromise limb salvage because orthopedic surgeons are limb savers as opposed to lifesavers in a general oncological principle, because anyone having a tumor in the extremity, it is very easy to just cut off that limb just proximal to it. But no, orthopedic oncology means to save the limb as well as save the life without compromising the function. That is why we are reading about it separately. It's a whole new different branch as compared to 30 years ago. When our seniors were reading about it, they would just chop off the extremity just proximal to the tumor, and would just tell the patient that life comes before quality of life. But yes, although it is true, but if there is no quality of life, there is no use of life as well. And after that, we talk about better quality of life. That is where the fine motor functions come into play. That is the importance of orthopedic oncology. So the diagnostic workflow in orthopedic oncology starts from clinical suspicion. You have a patient who has a musculoskeletal tumor. That is where your suspicion starts, and an X-ray with two views, two joints, and is taken first. It's always plain X-ray with two views and two joints, one proximal.
Orthopedic oncology deals with bone and soft tissue tumors. X-rays show lesions, but MRI reveals size and depth precisely. CT scans assess bone involvement and surgical planning. PT scans detect spread and metastasis. Expert review ensures accurate interpretation. Imaging guides biopsy for precise tissue sampling. This combination confirms diagnosis. It helps plan surgery or targeted therapy. Early detection preserves limb function. Advanced imaging improves outcomes in orthopedic oncology.